Okay. Okay. So hi everyone. I am Dr. Victoria Andarcia. I am a internal medicine physician, but I also practice integrative and functional medicine. And I now work with women on hormones. So anything from fertility to menopause, I do it, but I do work a lot with women with fertility. And the reason that I started to do that was because through my own journey with hormones, irregular periods and acne and all the things, I realized that if I was struggling as a physician, then it was going to be really hard for anyone who doesn't have the medical training to kind of navigate and learn these things as well. So the fertility webinar I've been doing now for several months, and this is the most comprehensive one that I've done, and it kind of just added a lot of people's questions throughout the presentation. If you do have any questions, you can just pop them in the chat box, and then as soon as I get a moment to like look at it, I'll definitely answer the questions for you. So this is for you. So hopefully you use the chat box, and I hope that you find it helpful. So just giving you like an outline for today. So fertility foundations, we're going to touch on birth control. We're going to touch on the like diet, supplements, exercise, how stress impacts it, and then like other alternative modalities that can help improve your fertility. And like I said, I'll be sharing some links that will take you directly to the supplements. But also for anyone who joins the call, I'll be sending out my fertility guide, which will kind of have all the information that we're talking about tonight in a more condensed form. Okay. So then the next step. So what's with fertility? Over the last few years, we have seen a decline in fertility. It's about 1 in 5 or 1 in 4 couples will struggle with fertility. And some of the things that we're seeing are, increased maternal age. Nutritional deficiencies is a big one. It's also sedentary lifestyles. If you're not exercising, I actually have had patients who exercise too much. We know that we have a lot of environmental exposures to things like BPA and heavy metals. And if you already don't have like a healthy lifestyle, if you have nutritional deficiencies, being exposed to the environmental toxins can start to impact fertility. But then you also have stress. And I'm going to show you later on in more detail how stress can directly impact your sex hormones and what are the things that you can do to overcome that. Okay. So, what are the key factors that influence fertility? Okay, so we already touched on this a little bit, but you got to look at the hormones, right? A lot of women who have PCOS or endometriosis are not diagnosed or they're diagnosed way later on, right? You have women who are getting periods, but maybe they're not ovulating and they're not aware that they're ovulating, or you have a regular cycle. So, you always want to look at those things. The other marker that I want everyone to kind of remember, if you are not familiar with it, is the anti-Müllerian hormone. So the anti-Müllerian hormone is a marker for ovarian reserve. And this gives you an idea of the quantity of eggs that you have remaining for, fertility or for conception. This is important, and it's one of the things that they test for anyone who is considering going IVF to see if you're going to be a good candidate or not for IVF. Now, I think the AMH is really important because it's not a test that is regularly done by your gynecologist. I mean, you can request it because I think that it gives you a good idea of whether or not you should freeze your eggs, or it just gives you an idea of how far along you should start planning for conception or for starting your family. So we're going to touch on this a little bit later, but this is a marker that is definitely underutilized when we're talking about fertility. Okay, so age and fertility, we already talked about advanced maternal age. But then there are definitely areas to maximize nutrition or even supplementation. If you're thinking about starting a family anytime within the next 6 months to a year, you want to quit smoking if you're a smoker, limiting alcohol, like maintaining a healthy weight, and you want to track your cycle. You want to see, am I actually ovulating? And not so that you can be like obsessive about ovulation, because that's not fun and it can be very stressful, but it's just to make sure that you're ovulating so that when that time comes, you know that that's something that you can check off of your list. And then checking your labs regularly, which Sometimes your doctor will be like, yeah, I checked your labs, but they're not checking your uh, hormone levels. So you want to ask them to check your hormone levels as well. So just to kind of go through this, this is our menstrual cycle. It kind of shows us here. Um, this is ovulation. Ovulation happens mid-cycle. So if day one is the first day of menses, the first day of your bleed, ovulation can happen anywhere between like day 10 and 18, but really kind of happens in the middle of your cycle. So that's when you want to take out your test strips and start seeing like, hey, is my LH spiking? That's what it's looking at. As soon as the LH spikes, then within the 24 to 48 hours, you have ovulation. So this is basically what you're looking for when you are trying to see if you're ovulating or not. Okay. So then my 2 cents on birth control. If anyone is on birth control and you're saying like, hey, within the next year or two, I want to start planning for my family, I want you to kind of think back, why did they put you on birth control? Because a lot of women are going to be put on birth control because they have irregular periods, because they have acne, because they have painful periods, right? And that's not really a reason to put anybody on birth control. Like, yes, it can be helpful, but the thing is that now I have women that are coming to me in their mid to late 30s and they're like, hey, I'm ready to have a family. And just now we're finding out that they might have PCOS or that they have endometriosis because the birth control pill was used to kind of help with the symptoms with good intentions, but you are masking a bigger problem. So if you are thinking like, hey, I might want to start a family in the next 2 to 3 years and you're on birth control and you were started on it because you were trying to control symptoms, we should probably come off of it sooner rather than later. That way, if there is an issue like endometriosis or PCOS, it can be addressed, before you get to that point, before you get to the point where you're like, hey, I'm ready to start my family now. So that's just my 2 cents. I'm not against birth control. I think it's a very helpful. Um, but it has to be for the right reasons. Okay. Okay. When to see a gynecologist. So, gynecologists, you want to see if you're having trouble with ovulation. Sometimes they'll do testing in their clinic to see if you have any fallopian tube abnormality or blockage, or they can test for uterine structural abnormalities. Okay. When we're talking about infertility, the blocked fallopian tubes I already mentioned. Um, that can be from endometriosis, could be from pelvic inflammatory disease, and you might not even know that you have these things. Uterine fibroids can cause issues with implantation and then endometriosis, right? So those are some of the things that can cause infertility. PCOS, you can have some congenital abnormalities, which is not very common, but it can happen. And then pelvic adhesion. So if you've had surgeries or endometriosis, it could cause adhesions. And so basically, that's just scar tissue that prevents like normal flow through the ovaries, or it can just cause issues with anywhere along the reproductive tract. So this can be tested with like ultrasound or a test called hysterosalpingography. Oh my gosh, I can't say that one. HSG, we'll just say. And that can be done by your gynecologist if you have any concerns about this. Okay. And I want to touch on miscarriage quickly because obviously it causes a lot of emotional distress. I don't think that we talk about it enough. And I think that we can be proactive. In finding out why. I've had several clients come to me who have been told by their doctor that they have to have like 3 miscarriages before you start to work up a miscarriage. And personally, I think that's too much. Like, I think that's really excessive. So I just want to touch on this because the most common cause of miscarriage in the first trimester, especially, is a genetic abnormality. And that is 1 in 4 pregnancies. So 25% of pregnancies will end in miscarriage. But the other reason can be if you have a hormonal imbalance, mainly if you have low progesterone in that luteal phase, so that after ovulation, because progesterone is called the progestation hormone. So that helps get the uterus ready for the egg to implant there, and that's where the baby grows. So, but if you have low progesterone, the uterus can't maintain that pregnancy. And I've seen that a couple of times where people will have low progesterone, but they're not even getting tested um, when they're having the miscarriage. So I definitely want us to pay attention to that. Thyroid disorders is another one, or if you have high prolactin levels. For thyroid disorders, a lot of times the doctor will just check your TSH level, and we'll talk about labs later, but that's not enough to assess thyroid health. It's really not. You want to get a full thyroid panel. You want to get your T3, your T4. You want to check the antibodies and make sure that you don't have like any autoimmune things going on with your thyroid, because you can have a normal TSH and still have positive antibodies. So that's one of the other ones. If you have autoimmune conditions, if you're already struggling with health, like diabetes, hypertension, that can be something. Or like severe emotional stress can also be less common reason, but it happens. And just remember, if anybody has any questions, just like pop it in the chat box and then we'll get to it. But yes, so my 2 cents on the miscarriage situation is that I wouldn't wait for the second or the third um, one to happen to get something checked. It's simple enough to get your hormone panel done in that situation so you can see if it's an issue with your progesterone. And the other thing I want to point out is that a lot of times we go to our gynecologist or OB um, for miscarriage and pregnancy, but there is a different group of practitioners, and they're known as reproductive endocrinologists, and they're specialists with anything involving reproductive issues. And they tend to be a little bit more proactive when it comes to looking at these things. So if you've been to a gynecologist and you feel like you've been dismissed, definitely check out if you can find a reproductive endocrinologist in your area. Okay. All right. So then, yes, so we talked about this a little bit, but what should be done after a first trimester miscarriage? So the labs, like I said, sometimes you can get uh, like chromosomal testing or genetic testing done. You can also just start focusing on like lifestyle stuff. If you're like really stressed, and not that like stress by itself can cause a miscarriage, but if you're really stressed, if you're not eating healthy, it's a really good time to kind of start getting your life ready for baby, for your family. And one of the other things that I want to point out is avoiding toxins, which is almost impossible, like in the world that we live in today. But there was a study done on the baby's umbilical cord. Well, not just one, but like multiple babies in the study. They were looking at toxin exposure right after birth, and they found anywhere between 232 and 300 toxins in their umbilical cord. And that was just like the baby was just born, and that's just from maternal exposures. So definitely things like plastic, what you're putting on your skin or your face or your makeup, like you want to start like cleaning up your environment. And here, like I said, future planning, you want to consult a fertility or reproductive endocrinologist so that they can develop a personalized plan for you. I wouldn't wait. Okay. So when should we start? So it's never too early. Anything that you do to improve your fertility is going to improve your overall health. So whenever it even just pops into your head, it's like a good time. And it doesn't have to be anything crazy, but like I said, looking at lifestyle, if you were on the pill and you're coming off of the pill, being on the pill long term can cause nutritional deficiencies, especially in B vitamins, which are essential when you are trying to have a baby, right? That's why you take a prenatal, because it has folate and it has other B vitamins. So as soon as you start thinking about it, I would start prepping for it. So nutrition. There's been a lot of studies on the Mediterranean diet because it's high in vegetables, fruits, olive oil. It's, low fat dairy, fish, and not a lot of sugar. So this is the most studied diet to help with fertility. And then why nutrition? So I'm just going to show you a picture here. So when you're looking at the liver, there's two phases of detoxification that happen in the liver. And a lot of the steps in detoxification require certain vitamins and nutrients. So you need B vitamins, you need magnesium, you need zinc, and it goes down the pathway. Like each pathway will need different micronutrients. And most Americans are deficient in multiple vitamins and minerals at the same time. So it really does matter what you're eating, not just for fertility purposes, but also just for optimizing your health in general. And some people, even if you have a really healthy diet, will experience or have low minerals or nutrients just because there's only so much we can get from our food. So that would require supplementation if you're struggling with detoxification, or even I always check a ferritin in my patients when we are doing the fertility panel. And ferritin, basically, if it's low, means low iron. And they might even be on a prenatal. So that just means that on top of the prenatal, you might just need extra supplementation for certain things. So then here we're talking about detox. I already talked about the B vitamins, sulfur-containing compounds, selenium, zinc, vitamin C. Those are some of the things that you'd want um, for adrenal function. So your adrenals sit right on top of your kidneys, and they're responsible for how we manage stress. And so for people who are very stressed, you'll start secreting a lot of cortisol, which is our stress hormone. But when you're in a high stress state, you're running through the vitamins here, so the C, the B, magnesium, zinc, and vitamin E, you run through them a lot faster than if you were not stressed. So you end up being depleted in these vitamins and nutrients, and that can make you feel worn down, more susceptible to infections. You can start having trouble sleeping. It can cause sensations of like anxiety. So this is just pointing to one of the other ways that paying attention to your nutrition is important, because it does not only affect your detoxification, it can affect how you manage and cope with stress. The other one is thyroid function, right? You need iodine, selenium, tyrosine, vitamin D, iron. All of these are important in different phases of converting thyroid hormone to active, from inactive to active. So just another thing that you want to pay attention to, and your prenatal will have most of these, if not all of them. And then the last one is hormone production. So when you're looking at optimizing your hormones, it all starts with cholesterol, right? That's the main one. And then from there, you start making your stress hormones, testosterone, estrogen, and progesterone. You need zinc, magnesium for basically everything. You need magnesium, vitamin D, your B vitamins, and essential fatty acids. One thing that I do want to point out about the essential fatty acids, and we'll probably get down to it later, but just so that I don't forget, is that they've done studies on women who supplement with omega-3s during their pregnancy, and that can lead to reduction or decreased risk of atopic diseases in kids, which basically would mean like eczema, asthma, hay fever, things like that. So not only for your health, but for the baby's health, supplementing with omega-3s or having a diet high in omega-3s can be beneficial. Okay. And I just put like a easy sample meal plan, because when you're talking about all these nutrients, it might seem like overwhelming. And you might think like there's no way I can get all of that in a day, but your breakfast would just simply be like an omelet with spinach, mushrooms, and tomatoes and whole grain toast. Your lunch would just be a grilled salmon salad with avocado, mixed greens, and lemon vinaigrette. You can even add some like nuts and seeds in there for extra nutrition. Your snack would be Greek yogurt with berries and walnuts, and then dinner would be like baked chicken breast with quinoa, roasted vegetables, and steamed broccoli. So yeah, it sounds like a lot, because I know a lot of us don't really meal prep that much, but like in reality, these are not that hard, right? Like it's hard to make time for it, but if you meal prepped, you can get it in. So it's not as crazy as it sounds. Okay, let me just make sure that I'm paying attention. Okay. Okay, so food is medicine. And then diet details. So I'll have women come to me and they're doing like intermittent fasting. I think intermittent fasting is great, but it's not great when you're trying to conceive, unless you have like diabetes or like you already know that you have insulin resistance. It's not something that is nice to our hormones, I would say, especially if you're already under a lot of stress. So if you're trying to get pregnant, I wouldn't do the intermittent fasting. Eating organic when you can, because organic food has a higher nutrient profile than conventional food. Avoid alcohol use. We already talked about that. Avoid processed food. And then the other thing that I always say is like the hot girl diet of crackers and cheese is not going to cut it, right? Like you're not getting enough nutrition from that. And you definitely just want to be making sure that you're eating enough and you're eating healthy food. Okay, let me see. What about caffeine? Okay, that's a good question. For the caffeine, you want to limit it to less than 200 milligrams. So that's like a small coffee, nothing crazy. Um, I've had people who like completely stop drinking caffeine and then they'll just like switch to tea. It's not necessary, but you want to keep it low. Okay. Meals and circadian rhythm. So this is more so just for overall health, but just to know you're more insulin sensitive in the morning, meaning that if I have a piece of toast in the morning, my body can break it down a lot easier than I have a piece of toast at night. So having your carbs earlier in the day can be helpful. Your cortisol also peaks in the morning and declines during the day. So another thing to pay attention to. And then melatonin um, is what helps us go to sleep, but it's also anti-inflammatory. So the next thing, we're going to get into the supplements now, but I just want everyone to know that this is for information purposes only. I don't know anybody's medical history. So if you do have any medical conditions or anything that you're worried about, medication interactions, you want to talk to a healthcare provider before you start taking the supplements. And like I said, I do have a fertility guide that will be going out to everyone who's on the webinar. And it'll also list my supplements on there too. So you don't really have to take notes or stress about catching everything. Okay. So the main ones are vitamin D. That's for both males and females. Having stable and adequate vitamin D levels are associated with better hormone production and improved chances of getting pregnant. CoQ10 has been shown to improve egg quality because it protects the eggs from like oxidative stress, which is basically inflammation. Your prenatal will have like methylated B vitamins because you need folate for nervous system development in the fetus, and B12 is also important. And then the other one that I want to talk about is this one, the myo-inositol. There's a company called Theralogics, and their myo-inositol is Ovasitol. And so the reason that I want to bring this up is because this is really good for anyone who has PCOS, or if you're not ovulating or not sure that you're ovulating correctly. It's a powder, or you can find it in pill form if you prefer. But basically, it starts to regulate your ovulation. So it can help you ovulate if you're not ovulating. But the other thing that it does is that it helps improve your blood sugar. So anybody who's at risk of gestational diabetes, it can decrease the risk of that as well. And then the other important one that I want to point out is iron. And like I said before, even though your prenatal has iron, that doesn't mean that it's enough. When you're getting your fertility labs checked, you want to check a ferritin, and you want your ferritin, which is your iron stores, to be like between 50 and 80 at least, because low iron levels have been associated with infertility, miscarriage, low birth weight, and preterm labor. Okay, and that's an easy one to fix. So I just want to highlight that. Okay, and then exercise. So I've seen both ends of the spectrum. I have had women who don't exercise at all. I definitely recommend starting exercise, whether it's 30 minutes 3 times a week, or if they want to, if you want to do more, it's better. But on the flip side of that, I do have women who have been struggling with fertility, who are doing a lot of high intensity workouts or a lot of cardio, like running marathons or half marathons, and that's great. But if you are already struggling with fertility in any way, you want to cut it back. Or if you're not working out at all, you want to start working out a little bit. So the exercise, too much or too little, you want to find a balance, especially if you've been struggling with fertility. Okay. Okay. Should you get an additional iron supplement in additional to prenatals if your iron is low? Yes, I've had to do that before. So if you are already on a prenatal and then you go and you get your ferritin checked and you've been on your prenatal for 3 months, 6 months, whatever it is, and your ferritin is still low, I definitely recommend that you just get a separate iron supplement to go ahead with that one. And I've had to do that. So that's a good question. Okay, so the benefits of exercise. It helps balance your hormones, weight management, stress reduction, and can improve blood flow to your reproductive organs. So that's that. And then the next one is cortisol, right? We talked a little bit about cortisol being a stress hormone, and that sounds bad, but it's important. We all need cortisol. It's just when it's in excess. And in the next slide, I'm going to show you why cortisol is important and why we need to talk about it. So this is how our hormones are made, right? Our hormone cascade. It starts with cholesterol, and then here you have some other hormones. You have progesterone, you have cortisol, but then all the way to the right, you have your estrogen, you have your testosterone. And what I've seen from testing in the clinic is that people who have a lot of stress or just like really anxious people, chronic stress, uh, they will start to produce more cortisol and more cortisol and more cortisol, right? Just because you're constantly stressed and we're not meant to be constantly stressed. That what happens is that you start to produce less testosterone and estrogen. So basically, it starts to affect the sex hormones, right? And that's what you need for getting pregnant. So let's see. Yes, the session is recorded. I'll send it out after. Um, so this is why managing stress is important. And I have seen women come to my clinic just for like prenatal counseling or for other issues. And, they might have like a really stressful job or they're a caretaker for a sick family member. And then you'll see like their cortisol levels are really high and then they have like no testosterone and no estrogen. So stress really matters. And I don't think that we talk about this enough. How can you test this? You can do urinary tests for the cortisol. You can do salivary testing, or honestly, with a questionnaire, or even just me asking you a couple questions, I'd be able to tell you if your cortisol is low, just because the symptoms are pretty straightforward and almost the same for everybody. Okay, let's see. Okay, so I just wanted to show you um, one of the tests. This is a male, but I just wanted to show you how stress over time, this guy in particular had really low testosterone, was working out a lot, but he could not build muscle and he had fat around the midsection, had trouble sleeping at night, and was depending on caffeine to get through the day from like morning to nighttime. So chronic stress over a really long period of time, initially when you're stressed, you're going to have high cortisol, but then over time, you're going to kind of like flatline a little bit because your body is like even tired of making cortisol. It's like, I can't even do this anymore. So when this happens, it didn't matter how much he was working out because his body was so depleted that he couldn't have made testosterone if he wanted to. So what you have to do with that, it was like a lot of lifestyle stuff, supplementation, changing diets, not drinking caffeine. When you get to this point, or if you're an anxious or stressed person in general, keeping the caffeine down can be helpful because adding caffeine can further stimulate or secrete cortisol, and that doesn't help. But I just wanted to show you what happens with chronic stress. This was one of my fertility clients. She had high cortisol levels and she got sick often. She was having trouble with weight loss. And then she felt wired but tired. I don't know if anyone's ever felt that, but it's like where you're going through the day. And I mean, I've never done cocaine, but I would imagine that it's kind of like that, where you're just like overstimulated and you're like, I'm so tired, I need to go to sleep, but you can't. That's that wired but tired feeling. So that's how uh, she presented, and it took about 6 months, but just with some lifestyle stuff, and just making sure we got her hormones optimized, she was able to get pregnant. Okay, and then this is another one. This is also a very stressed out female. She was like jittery all the time. When she worked out, which was a new symptom, she felt like she had to take a nap after, which is not a normal feeling. If you're working out and then you're tired, that's one thing, but working out and then feeling like you have to go take a nap, that's a sign of cortisol imbalance. And needing naps throughout the day, if it's every once in a while, that's fine. But if every day around like 3 or 4, you're like, I need a nap, also cortisol imbalance. And then she was also having PMS symptoms, which she had never had, and her periods were irregular. So that was just another sign of imbalance for her. How do you fix cortisol levels? Let me see. Okay, so when you're trying to fix cortisol levels, I don't know that I have any slides on that, but um, you can't really escape lifestyle. So that's the first thing I'm going to say. If you are drinking a lot of caffeine or Celsius or Monster to get through the day, the first thing I would say is that you need to stop that. Right? You drink your 1 cup of coffee in the morning and then you try to get through the day. There's also supplements you can take, like adaptogens. I don't know if you've heard of ashwagandha is one of them, but you have holy basil, you have rhodiola. There's a lot of adaptogens. And they've done a lot of studies on adaptogens to help with cortisol production or just to help your body manage stress. And when your cortisol levels are dysregulated, your B vitamins and your magnesium is going to be low. So you want to supplement with that. So that's one thing, but definitely dealing with whatever is causing that is something else. Like if you're not sleeping as much as you need to be sleeping, because you're on your phone or because you're stressed out about your job, we need to start focusing on the sleep part. If you're skipping meals, someone who has cortisol imbalance or something like this, you should not be intermittent fasting because then your body gets more stressed out. In this particular client, she was doing a lot of high intensity interval training exercises. We had to cut back. We had to stop that for a little while and just switch to strength training until she could uh, do a workout without needing to take a nap after. So it's very specific to the individual, but there are things in your life that you can do. And then over time, I've had women who present like this who are runners and they run like 10Ks and like they want to run like 20 miles, on a Saturday, but you can't do that when your hormones are like this. So over a period of like 3 to 6 months, working on lifestyle and the supplements, you can get back to that. You just have to take a break from certain things, but it really depends on the individual. And then the other thing that I've seen be very successful is traditional Chinese medicine. So that's including acupuncture, and it also includes some of the herbs that they give you when you go to a traditional Chinese medicine practitioner. And I have a podcast, the Healthful Roots podcast. I have a traditional Chinese medicine practitioner on there, and she talks about how and why that can be helpful for fertility. But it's one of the things that I have almost all my fertility patients do. I have them go to a traditional Chinese medicine provider that specializes in fertility because it can help with blood flow, but also it's one of the only things I've seen that can kind of help slightly improve that anti-Müllerian hormone that we talked about at the beginning, which is the one that tells you about your ovarian reserve. And I mean, it doesn't increase it much, but it increases it a little bit. And I feel like any little bit helps. Okay. And it's complementary. I've had women who are doing IVF or planning on IVF who will do the traditional Chinese medicine, the acupuncture or the herbs, or they'll just do the acupuncture if they don't want any of the herbs to be interacting with what they're doing. It can help with stress management. It helps regulate your hormones, and it can help with implantation, is what some of the studies have shown. The other thing we kind of talked about a little bit already was the environmental toxins, but there are some in our house that we should get rid of. So the first one is BPA. So if you're drinking out of plastic water bottles, or you have cans that have BPA in the lining, the issue with the BPAs is that it mimics estrogen in your body, and that can lead to hormonal imbalance. Phthalates is also in plastic, but it's also found in personal care products. So you want to be sure that your personal care products don't have this. Pesticides, glyphosate. Glyphosate is in some of our like wheat products, or I mean, it can be really in anything, but that's something that you want to minimize if you can. Parabens also found in cosmetics, um, PCBs, like these, all of these can, it's hard to avoid. I don't think anybody can avoid it completely, but there are things you can do. Getting rid of the plastic in your house, making sure that you're switching your cleaning products and your skincare products, that can make a big difference. Oh, and the other one is the plugins, air fresheners in your house. That can have a lot of these chemicals as well. So definitely one of the things that you want to look at if you have it. Okay. Then functional testing. So this is kind of like if you're already down the line, you've looked at your hormones, and you're still struggling and you don't know what's going on, you can do functional testing. So we're just going to chat about that really quick. So the first one is the comprehensive hormone panel. That is the first one you should do, and I'm guessing that a lot of women uh, haven't had them done. So you want to get your AMH level done to estimate your ovarian reserve. Let's say that you're 35 years old and you get the AMH, and when you do that, you see, wow, my ovarian reserve is low. At that point, my recommendation, or maybe a reproductive endocrinologist would say, maybe we freeze your eggs, right? So that you have more time to start planning for your family. I think it's just really good for planning in general. Or let's say you're 39 and you're like, okay, I'm going to start having my family now. If your AMH level is low, I would say don't even wait, just go straight to the reproductive endocrinologist. So that's how that's helpful. So I do a comprehensive hormone panel, but I include the AMH. Thyroid panel, like I said, your doctor most likely will not check the full thyroid panel. They'll just go for the TSH, but you want the full one. If you're having like a lot of gut issues, that matters because part of our hormones are broken down in our large intestine, our liver, and our large intestine. So if you have a lot of inflammation in your gut, a lot of bloating, one, not only are you not breaking down the hormones properly, but you're also not absorbing the supplements or the food that you're eating properly, right? So you can do a comprehensive stool analysis, you can test for nutritional deficiencies, and if you think that stress, it plays a role, then you can do an adrenal stress profile. And that can be, like I said, salivary or urinary. A blood test is not enough to look at that. Okay. Uh, then here, we're just going to run through one of my client cases, and then we'll just open up to questions. So for this one, I had a 39-year-old female. She had a history of endometriosis. She had laparoscopic surgery, not only for diagnosis of the endometriosis, but to treat some of the spots that she had it in. She had a low AMH, and because her AMH was so low, she was told that she was not a candidate for IVF, and her provider basically said, like, good luck. I don't think you'll get pregnant. But what did we do? So we worked on her gut health because she did have some GI symptoms. We did that test that I showed you with the cortisol. She started exercising, not something that she was doing, and we did some like stress management because her cortisol levels were really high. Then we also started her on some supplementation. And then she also started acupuncture, but this was like the acupuncture we didn't start until 6 months in because, she still hadn't gotten pregnant within the 6 months, but then she got pregnant and now she has a baby. And when she went back to the provider that had been seeing her, who told her that she wasn't going to get pregnant, he basically said, you need to play the lottery, right? Because the chances of that happening had been so low. But I don't think that it was just that. Unfortunately, fertility is a struggle, but I do think that all the things that she did in preparation did really help her get pregnant. So I just wanted to share that because I do think that if a doctor told me like, hey, you're not getting pregnant and it was something I wanted, I'd be like, destroyed and devastated, and I just would probably give up. But she didn't, and it actually worked out to her advantage, and it was all lifestyle. We didn't do anything crazy. Um, so that so this was her her high cortisol test, which I already showed you. And this just shows because of the endometriosis, she had pretty high levels of estrogen and trouble with the detoxification. You don't need to learn how to read this, but that's basically what this shows you is that her estrogen was high, but then her clearance and ability to clear the estrogen was also impaired, probably because of all the gut issues that she was having. Okay. All right. So does anybody have any questions on anything that I shared or anything that I didn't share that maybe I can answer? And for anybody who didn't catch the beginning, I'm going to share this link here. So this is my link tree. There you'll find a link to the full script where I have my fertility stack, and I'll have a lot of the supplements that we talked about there, so you can find that there. I'll be sending you a fertility guide. I also have a link to a free 15-minute call. So if anybody's like, that was great, but I just have more questions and I want to do it in private, you can just schedule a free 15-minute call and we can talk about it. But the other thing is I have the link to the podcast episodes. And so the podcast, I've had perinatal psychiatrists, I've had pelvic therapists, I had the traditional Chinese medicine lady, I've had postpartum doulas. Like it pretty much has been around pregnancy, pre and post. So if you're like, I want to learn a little bit more, you can do so on that podcast because it's basically tailored towards this. Let me see.
I have a question. When you mention about gut health, can you specify? I know you cannot give it, where it's confidential because we don't know who the client is, but can you give some specifics? Like when you say gut, can you talk about that a little bit further, please? Just like
Yeah.
what you
Okay.
mean.
Yeah, because that is an umbrella term, right? And it's not specific. So when I say like gut health, I will talk about that patient specifically because we had it there. So she was having a lot of bloating. Anytime that she had a meal, she would feel bloating. She was belching a lot, which like we think, oh, like, burped, that person burped. That's actually not normal, right? Like you shouldn't be belching after like meals. That's a sign that you're having issues with your GI symptoms. If you're having constipation, that's an issue. So that's what I mean gut health, because if you're constipated, you're not clearing out estrogen properly from your large intestine where you're detoxifying estrogen. So that's something that you want to work on. And then I have women who say, like, I have 3 to 4 really loose, runny bowel movements a day. That's also not normal, right? Like 1 to 2 bowel movements a day is normal. Um, Telling me that you're having a bowel movement once a week, that's also a big problem. Acid reflux is an issue. So anybody who has acid reflux, let's say that your doctor put you on like Protonix, omeprazole, Zantac, um, that's not meant to be taken for long term. That's just supposed to be a short-term solution, like 6 to 8 weeks, because if you take that long term, it actually prevents you from absorbing uh, supplements, medications. Like the absorption is totally messed up. So you want to be able to get people off of those types of medications. And that's what I mean when I say gut health.
Thank you.
No problem. Does anybody else have any questions?
And the link that you mentioned, if we want to get a consult, it's going to be sent to us. Is that accurate?
Yeah, so if you look, I put it in the chat. I think I did.
Okay.
In the chat box, that link tree, there's a link there. Um, and that will take you, it'll say free 15-minute consult right there. So you just click that and you'll find it. And then I'll also include it when I send out the recording. I'll put the link in there too so that you have it.
Thank you.
All right, no problem. I hope this was very helpful for everybody. And like I said, you can reach out to me on my Instagram. You can reach out with the free 15-minute call. Whatever questions you have, I'll be happy to answer them. And
Thank
hold
you.
one question here. If you're starting an IVS cycle right now, is it too late to start acupuncture? No, it is not. I probably wouldn't do the herbs just to be conservative, but I would say that acupuncture itself would be beneficial. All right, and you're very welcome. All right. Signing off. I hope you guys have a wonderful evening. Thank you for coming.
Thank you.